and a quorum of the board is present. The State Board of Education meeting of April 14th, 2020 is called to order. Due to the COVID-19 national emergency and in accordance with Executive Directive 2020-2 and Executive Order 2020-15, State Board of Education meeting is being convened with remote access technology. The first item on the agenda is the approval of agenda in order of priority. Are there any items board members would like to add or delete from the agenda? Seeing none, may I please have a motion to approve the agenda in order of priority?
So moved.
Support.
We have move and support. That was moved by
Cassandra.
President Ulbrich and supported by Board Member McMillan. Any discussion? All in favor? We have a roll call vote. Marilyn, please.
Pecto?
Yes.
McMillan?
Yes.
Pritchett?
Yes.
Pugh?
Yes.
Ramos-Montini?
Yes.
Snyder?
Yes.
Tilley?
Yes.
Ulbrich?
Yes.
Motion passes.
Very good. Marilyn, we turn to you to introduce our members of the State Board of Education, please.
I'm happy to do so. I'm Marilyn Schneider. I'm the State Board Executive, and I will introduce the members of the State Board of Education to you. Dr. Cassandra Ulbrich is the president of the board, and she's from Dearborn. Dr. Pamela Pugh is the vice president. She's from Saginaw. Ms. Michelle Fecto is the secretary from Detroit. Mr. Tom McMillan is the treasurer from Oakland Township. Ms. Tiffany Tilley is the NASB delegate from Southfield. That's the Boards Association, National Association of State Boards of Education. Dr. Judy Pritchett is a board member from Washington Township. Ms. Lupe Ramos-Montini is a board member from Grand Rapids. Ms. Nikki Snyder is a board member from Dexter. We also have Ms. Brandy Johnson. She's representing the governor. She's the governor's policy advisor for education and workforce. And Ms. Kara Lougheed, Michigan Teacher of the Year. She's an English language arts and history teacher from Stony Creek High School in Rochester Community Schools. Thank you, Dr. Rice.
Thank you, Marilyn. The first item on the agenda is educational updates related to COVID-19. Board members, as you are aware, this is a board meeting dedicated almost exclusively to public education since the advent of the COVID-19 crisis in the state. On March 10th, 5 weeks ago today, as you may recall, we held our last state board meeting. At the beginning of the meeting, there were no known COVID-19 cases in the state. By the end of the meeting, the first two had been announced. 2 days later, on March 12th, with 12 COVID-19 cases, the governor issued Executive Order 2020-05 to close school buildings across the state for 3 weeks. On March 23rd, the governor issued Executive Order 2020-21, the Stay Home, Stay Safe order. This order extended the period of school building closure through April 13th, 2020. On April 2nd, the governor issued Executive Order 2020-35 to close school buildings for the rest of the school year and to establish the means by which schools would operate during the remainder of the school year. I appreciate the governor's aggressive leadership during this period, unprecedented during modern times. Apart from closing school buildings for instruction for the rest of the year, Executive Order 2020-35 did the following. Required local school districts and public school academies to establish continuity of learning plans for submission and approval to intermediate school districts, public school. Begin work under these on or before April 28th. Set aside the state requirement to administer assessments, MSTEP, MME, MyAccess, WEDIS, SAT, and work keys, and to report the results of each. Set aside state requirement to do annual performance evaluations for teachers and administrators, provided for the parameters within which local school districts address credits and grades for 12th graders, provided for the education of special needs students both during and after the emergency, set aside certain laws to permit for 1 year the granting of teacher and other educator certifications and permits on an emergency basis without the otherwise statutorily requisite professional development hours or passage of teacher exams. Thanks to Brandy Johnson, the governor's representative on the State Board of Education, and to others in the administration and outside for their partnership during the last week and a half, as we have collectively worked to interpret, flesh out, and extend upon Executive Order 2020-35. The executive order provided an enormous amount of direction during this public health crisis, direction only possible from a governor or a state legislature, given the need to set aside a number of laws. Inevitably, though, even a document as helpful as the current executive order requires additional work to flesh out. We are working with and continue discussion with the governor's office on additional elements associated with Executive Order 2020-35, including all early childhood programs, exceptions associated with the evaluation set aside noted above, including teacher tenure issues and issues of non-performance, and graduation. Today's meeting board will include brief presentations on the following: preparation and distribution of food, provision of childcare for the children of essential workers in local school buildings, social and emotional supports, learning at a distance / continuity of learning plans, special education, school finance, and assessment / accountability. As the board is aware, we have issued and continue to issue to local school districts, intermediate school districts, and public school academies significant guidance in each of these areas in a very dynamic environment. As recently as last week, we released substantial, updated, and/or embellished guidance regarding food preparation and distribution, social and emotional supports, learning at a distance, and special education. I appreciate very much the partnerships with our education organizations, including, but not limited to, MEA, AFT Michigan, MASA, Middle Cities, MASB, MAISA, MAPSA, MEMSPA, MASSP, MSBO, and Michigan Virtual. I also appreciate how department staff members have stepped up in a big way at this time. We benefited from the partnership with Michigan teacher leaders, in particular our state teacher of the year, Kara Lougheed, and the regional teachers of the year, Rachel Gustafson, Amanda Clemens, Katie Farrell, Jeremy Windsor, Jessica Matthews, Tricia Zeman, Doug Duncan, Crystalyn Musselman, and Michelle Pizzo. They provided tremendous writing and leadership as they worked to convert the broad thinking of education or associations, and department staff, and leaders into a document both useful for and accessible to their teaching colleagues. And for that, we are grateful. I appreciate also the opportunity to have spoken with more than 450 local school superintendents in the last month. The insights of our district superintendents have been helpful in crafting guidance during this challenging period. And finally, my thanks to those on the front line, our teachers, our support staff members, our local school administrators, who have had to do the best that they can to continue to educate children in the midst of a pandemic, when their typical instructional means and methods were removed. I ask both board members and staff presenters today to remain cognizant of our schedule. The board has been kept apprised of work over the last 5 weeks. This is an opportunity to share thoughts for and with the board and community, and to answer broad strokes questions. We'll begin this morning with a presentation on food preparation and distribution from Mr. Kyle Garant, our Deputy Superintendent for Finance and Operations, and Dr. Diane Golzinski, our Director of Health and Nutrition Services. Mr. Garant and Dr. Golzinski, the virtual floor is yours.
Thank you, Dr. Ice, and good morning, everyone. School meals have played a vital role in our response to school closure. Ensuring children have access to meals is a continued focus, both for us at the department and also our partners at the local level. We are so proud to partner with school districts and community-based organizations who have really stepped up during these challenging times to ensure that children and families have access to meals ever since school was closed to in-person learning. I'd also like to thank Dr. Lozinski and our child nutrition team at the department who have worked hard and provided leadership to support our local level partners in providing food safely to students during this challenging time. With that, I'd like to turn it over to Dr. Diane Glazinski, who will give you more specific updates about our work to support the provision of food and distribution during school closure.
Thank you, Kyle. Good morning, everyone. It's my pleasure to be here and to update you on our efforts for feeding children during this pandemic. With the first executive order closing schools for 3 weeks, the Office of Health and Nutrition Services worked closely with Dr. Rice and others to begin a program called Unanticipated School Closure Meals. This is a provision in our USDA child nutrition programs, which often is used during such things as snow days or a polar vortex. Thankfully, we were ready, and in less than 24 hours from the announcement, we had held town hall webinars with over 1,200 people outlining how schools and community sponsors could provide meals to children during this unanticipated school closure. As a result, we have had over 600 sponsors step up and provide meals in a variety of fashions all around the state. Under the most recent executive order, all public school districts, including public school academies, are required to provide or arrange for continuation of food distribution to eligible pupils. This means that every public school district or public school academy must provide a plan that outlines how they are taking an active role in assuring families in need are receiving food until the end of the scheduled school year. Until the end of the scheduled school year, unanticipated school closure meals remain in place. After the end of that scheduled school year, if the sponsor qualifies for the summer food service program, they will begin regular summer food service program or traditional SFSP. Under this unanticipated school closure meals program, all meals are served free to all children ages 0 to 18 or 0 to 26 if special education. Most sponsors are providing 2 meals or 1 meal plus 1 snack, and children are not required to be present at pickup or delivery. Meals for adults are not allowed without a separate funding source from the USDA child nutrition programs. The method of distribution remains local choice. Some are choosing drive-through or pickup style. Others are using bus routes or mobile routes, and others are using a combination of the two. The decisions made at the local level really come down to staffing capacity, distribution capacity, and storage capacity. So how are we doing with the meals that have been served so far? As of yesterday, we had approximately 57% of our sponsors reporting their meal service numbers for the month of March. From those claims, we know that over 2.0 million breakfasts and 2.8 million lunches have been served during those 2 weeks in March for which schools were closed. You will see an image of the meals map, which can be found at www.michigan.gov/meetupeatup. The green locations were locations open on the day that I took the picture of the map. The red locations were closed on that particular day. The map is updated twice each day to provide the most up-to-date information to our families as we possibly can. In addition, the data that populates this map are shared with our state SNAP agency, our state WIC agency, and 211 every day in an effort to be sure families know where they can find meals. From the sites on the map to the stories told through our weekly town hall webinars, emails, social media posts, and text messages, we know that the number served is significantly higher. While we also know the numbers will not likely reach those of a normal National School Lunch Program month, where we would average around 7 to 10 million breakfasts and lunches, we are extremely proud and thankful for all of our school food service staff have done to continue to be a part of the solution for our state. With any crisis, new learning and flexibilities are offered that may not have existed before. Under these two websites, the waivers or flexibilities that the USDA has provided for our state are outlined. Both web pages are updated as the USDA announces approvals of additional waivers and flexibilities. The most recent approval was for site eligibility for our unanticipated school closure sites. It waives the requirement for sites to be in areas where poor economic conditions exist. Here in Michigan, we had already allowed that flexibility with our first webinar on March 13th, when we told all districts that they could operate this program. We are also careful not to take the safety of our local food service staff lightly. We appreciate and understand that this is an incredibly stressful time. Last week, we released a joint memo with the Michigan Department of Agriculture and Rural Development called Best Practices for School Food Service Providing Meals During COVID-19. We've also heard that some areas are having issues with crowd control. Our local sponsors are to work closely with local law enforcement and consider spreading out meal pickup to prevent congregation of crowds. The MDE webpage and our unanticipated school closure webpage have been updated and organized for a better customer experience. As I said before, we are holding weekly town hall webinars with school and community partners, child care providers, and industry partners to hear their stories, address their challenges, and update everyone involved in a consistent and timely manner. Pandemic EBT, or P-EBT, is a brand new program made available through the Families First Coronavirus Act, signed into law on March 18th. Michigan was the first state to submit a plan and to be approved to begin to distribute benefits. So what exactly is P-EBT? P-EBT are benefits similar to the Supplemental Nutrition Assistance Program, also known as SNAP or food stamps. These are benefits for all families with children who were receiving free or reduced meals prior to the crisis, including all children at community eligibility provision sites and all those directly certified or certified by categorical eligibility, such as homelessness or runaway, or by application at the local level. The benefit will be in the amount equivalent to the reimbursement rate for a free breakfast plus a free lunch, multiplied by the number of days of the closure per month per child. And they are expected to continue through the end of the school year. Those already receiving SNAP benefits will see the P-EBT benefit added to their bridge cards by the end of this week. Those not receiving SNAP benefits will get a bridge card in the mail by the end of this month, and they will need to pin that card to provide their consent for participation. A couple of key notes in understanding P-EBT. These are not SNAP benefits. They are considered pandemic EBT benefits. Also, with the extreme number of unemployment cases, there are many, many families who now would be relying on free meals at school, but who will not receive these benefits because they were not in that financial situation prior to the pandemic. Those are the families who may still fall through the cracks with this particular program. Another new program that we are implementing is called Meals to You. It is brand new and it will assist some families in rural Michigan during this pandemic. It is a demonstration project with Baylor University in Texas with a limited number of meals available to our state. As a result, we invited only 26 local school districts to participate. The qualifications for those 26 were that they had to be closed for at least 4 weeks. They had to be buildings with 50% or higher free and reduced lunch eligibility, and they had to have a USDA designation of rural. If the district chooses to participate, the children who were eligible for free or reduced meals prior to the pandemic will receive one box every 2 weeks with 20 meals in it, 10 meals and 10 breakfasts. And that box will arrive by mail or by UPS. So as school districts are writing their plans, we also reminded everyone that we must all be a part of the solution. Plans should not rely on only one method of meeting the needs of the children enrolled in the local school district. As Dr. Rice stated yesterday, we cannot accept a one-legged stool. Our local food banks are reporting that they are serving the needs of more than 4 times their normal amount and may run out of food as soon as this week. Simply saying that families will be referred to the local food bank just cannot be accepted. Active and formal partnerships with a local food bank to ensure that an equivalent amount of food is provided is really the expectation. If someone wishes to provide groceries or the equivalent to families, it's important to remember that there must be private donations to cover those costs, as those are not allowable expenses to the School Food Service Fund. In addition, as I've said before, many more families are in need now than just those who were enrolled for free or reduced price schools prior to the pandemic. So with that, I would be happy to take any questions.
Thank you, Kyle. Thank you, Dr. Golzinski. Any questions from board members? I'm looking in the chat to see your raised hands. Questions or comments? President Ulbrich.
Thank you so much. This was a really helpful presentation, and I just want to say how grateful we are to MDE, but also all of the people on the front line who are providing all of these meals and making sure that kids in Michigan continue to get fed despite these terrible times. One quick question about the Meals to You program. I understand it's limited to 26 districts, and I understand the qualifications for those districts. But beyond that, how did you narrow down the 26?
That's a great question. Because the number of meals were limited, we decided to really look at the districts who were not participating in the unanticipated school closures. So we knew that those kids did not have access through their own school district through that program. And when we added up the number of kids eligible, it came very close to the number of meals that were available to our state. So they are all Northern Lower Michigan or UP schools.
Thank you, President Ulbrich. Dr. Pugh, Ms. Fecto, Ms. Snyder, in that order. Dr. Pugh.
I just wanted to concur with Dr. Ulbrich, and just seeing how you all were able to so quickly pull this together for our families across the state is nothing more than or less than miraculous. And my question is just around, I was really happy to see how you were protecting these essential workers, and just wondering, and I might have missed this, are we monitoring the health of those essential workers, as well as providing them with any, I see that I saw that they were wearing masks. Is there any way that they can also be afforded protective equipment, and know that that's a big, scary mess that's across this nation?
Yes, certainly. Personal protective equipment is a big concern for our healthcare workers, and therefore at this time really isn't available to our school food service staff. Our local county health departments are really the leaders for protecting those staff and doing any monitoring. That's why we partnered with the Department of Agriculture and Rural Development in providing our safety guidance. And those local health departments, some have checklists, some are doing health checks or health screenings prior to those workers coming into work each day. It's really going to be dependent on the county and the level of response at the county level, but everyone is doing what they can to protect those workers. And then where workers are falling ill or there is a shortage of workers, we are able to work with the county emergency manager to get additional volunteers in to help assemble meals and distribute meals for children.
Thank you.
Dr. Pugh, did you have a follow-up?
No, I mean, I just can't stress and emphasize. I don't think that people, well, just making sure that they know how important and how essential they are and how important it is for them to protect their health as well as their family health. And I am happy with the information that you are giving to these essential workers and making sure that they're protecting themselves as well as their families when they're going home. So we just can't say it enough.
Okay, thank you, Dr. Pugh. Ms. Fecto, then Ms. Snyder.
Okay. Yeah, I just wanted to echo some of those sentiments. I'm really proud of the department being a leader around getting food out, and it's here I see in Detroit firsthand how this is incredibly important. I know my husband, as a teacher, has volunteered in his school district to distribute, and it's good for the kids to see the teachers face to face, help them feel like there's still some sort of connection and people caring about them. So I had a couple of questions though. One was on the SNAP benefits or whatever, they're not SNAP benefits. Is there an age limit on that? And how do we, I'm wondering about, students or recipients of special ed up to age 26 who might have SSI. And if that the food stamps would come to those, or the additional money on the SNAP would come to them. So that was one question. The second question is it been, I know it's to package things up as a weekly meal so that people don't have to come so often and travel. And if that's an option or if that's something that's encouraged to have more bulk food given for like a week period to limit the amount of interaction. That's it.
Thank you.
Those are great questions. So pandemic EBT is the name that we are promoting versus SNAP benefits, and that's because we don't want confusion for folks who may not want to accept SNAP benefits. We want folks to know that this really is just in response to the pandemic, and these are benefits to help those families. So P-EBT is the name of that. It is our application that was accepted and approved by USDA, simply stated school-aged children. And so the SNAP agency from the Michigan Department of Health and Human Services and I have decided to really look at that broadly, and we are defining that as any child who was enrolled in a local school district. So that provides us with a large number of kids who would then be eligible. Those kids are all in our Michigan student data system as qualifying for school meals under free or reduced categories. And those are the names and addresses that we were able to share with our SNAP agency. The special ed kids getting SSI, if they are enrolled in a school program, then yes, they are all included. We also worked with our special populations unit to make sure that all homeless and runaway and migrant kids and everybody who would normally be able to qualify for these meals in a school building would also get these benefits through this program. Your next question was about packages or bulk items, and yes, we are absolutely encouraging that around the state. It is, I know some of our districts in the UP are providing a full week or even 2 weeks worth of meals at one time. In some cases, it's in bulk. It might be a loaf of bread or a gallon of milk per child. However, the quantities work out to equal a full meal. Some of our larger school districts are struggling to provide that much food at one time, simply because that amount of milk and all of that food doesn't fit in their cooler space, which normally they would turn over food every 1 or 2 days. So they're doing distribution as often as they need to fit the storage space and the staffing availability that they have to provide meals. But the number of meals is wide open. Whatever their capacity can handle, they are allowed and encouraged to distribute as few times as possible to lessen the number of times that they are in contact with each other as well as with the public.
Very good. Thank you.
You're welcome.
Thank you very much. Ms. Snyder.
Thank you. And actually, Diane, you just answered all the questions that I had, so good. Thank you.
Magic.
Okay, thank you very much. Any other questions or comments from state board members? Hearing and seeing none, I would just like to thank Kyle Garant, Dr. Diane Golzinski for their leadership and for the leadership of their staff members as well. It's been an enormous enterprise to get this up and rolling, and we've done it with partnership across the state, 2,000 plus sites, some stationary, some mobile, but all act. An enormous enterprise. We've become a different state. We've become a different country in the last month, and we appreciate your leadership. Thank you so much.
Thank you.
Thank you.
Our next topic is Child Care Board. This presentation will be led by Dr. Scott Kenickschnecht, Deputy Superintendent of P-20 System and Student Transitions, and Ms. Lisa Brewer-Walraven, Director of Child Development and Care. There will be a PowerPoint presentation. Dr. Kenickschnecht and Lisa Brewer-Walraven, welcome.
Thank you, Dr. Rice, and thank you to the board for giving us the opportunity to give you an update on all of the activity that we have been doing around childcare. Lisa Brewer-Walraven is on the call, and she will be pulling up the PowerPoint that we will walk you through here shortly. Lisa, if you can share your screen.
Yeah.
So as Lisa is prepping this, as I've shared, we've been doing a great deal of work throughout our Office of Child Care, and then in partnership with many other entities. Lisa and I have presented to you before and talked about the complexities and the relationships involved with providing child care. It's not something that MDE does on its own at all. We do it with multiple partners, and Lisa's going to talk more specifically about them. But we continue to have those strong partnerships with DHHS, with LARA, with the governor's office. Michelle Richards has been in the conversation on a daily basis with us, as well as a number of other partners. And so, Lisa, I am going to turn it over to you to talk more specifically about that and the actions and activities that we have initiated over the past couple of weeks.
Okay. Hopefully the slides are up now and everyone can see them. We appreciate this opportunity to share the efforts that the department has participated in to collaborate and work together to support children and families and providers to ensure their child care needs have been met across the state. Our focus has really been around working with a broad array of partners to coordinate, break down barriers, address concerns, and provide support through a variety of mechanisms. And we've worked with licensing and regulatory affairs to ensure that providers who are still operating and caring for essential staff are in safe settings, and providers have information for conducting health and safety screenings and strategies in place for keeping children safe. We've worked with the intermediate school districts, the regional early childhood support networks, the Great Start to Quality resource centers to help essential staff find childcare in their community that will meet their needs, as well as to answer new and emerging questions that are coming up as that care is being provided. We've worked with the Early Childhood Investment Corporation, who quickly put together a survey to help identify opened and closed providers across the state to ensure that those providers have supports, that they have access to needed training and supports. We've worked with the Department of Health and Human Services to make adjustments that allow providers to continue to be paid whether they're opened or closed, and to ensure that school-age children have access to the care that they also need. We've worked with Michelle Richard from the Governor's Office, as Scott mentioned, to continue to break down barriers, update our frequently asked questions, and provide guidance to our partners and providers. And we've been able to join opportunities that the Child and Adult Care Food Program have pulled together, where they're bringing their food sponsors together to address questions that are coming up from providers. We've created a number of support items to help with this coordination, collaboration, and getting information to our partners. Initially, we worked on frequently asked questions that were very specific to the child care subsidy program, whether it was around billing or payments, what should happen for school-age children, how providers could still access training, how they could still get supports with the Great Start to Quality rating system. But then we worked with childcare licensing really to focus on ensuring that those providers who are going to be open and providing care for the essential workers had the information that they needed to operate. Part of that coordination also involved the Department of Health and Human Services, as they helped us put together the information on screening provisions, health and safety provisions, and how we could share best practices and guidance from the Center for Disease Control that was put out specifically to support child care providers. Based on the amount of information that has been produced for child care providers, we worked last week to combine all of that information and put it at the DHHS COVID website. There is now a specific resource page for child care providers so that they can go to find all of this information in one location versus maybe having to look in multiple locations. We continue to work to address questions that are coming up around unemployment insurance benefits and how to apply for those benefits in the event that the provider is no longer working. We've also been trying to get out information about the Payroll Protection Program, which is an opportunity for small businesses to have access to funds through the CARES Act. We continue to update that information ongoing, so we're always in contact with our partners and letting them know when that information is updated so they have the best resources. We've also spent some time looking at the CARES Act funding that Congress appropriated to help with the pandemic. $3.5 billion was appropriated by Congress to support child care needs across states and territories. We estimate Michigan will get about 100 million of those dollars. And we've been working very collaboratively with partners and others to come up with an opportunity for grants for providers that will do a couple of things. It will help ease the burden of childcare costs for essential workers. It will help ensure that providers know that we are trying to support them and want to make sure that they're able to offer health and safe care for children. And we want to ensure that we're supporting providers who have been closed during the pandemic so that when the stay-home order ends and everyone is going back to work, there will be childcare providers to provide childcare for families again. I think that's our high-level summary. We're also happy to answer any questions you may have.
Thank you, Dr. Kay. Thank you, Lisa. Board members, questions or comments about childcare? Hugely important area at this time, hugely important area in general, but a particularly important area at the moment. Board member Snyder.
just want to say thank you so much. This topic of childcare, especially as a nurse and a healthcare member that has 3 young children, it almost brings tears to my eyes to hear you guys talking about all the things that you're doing and all of this collaboration. Just years worth of young children just getting to work, you know, when you work days, evenings, night shift, weekends, holidays, when we're outside of a pandemic is something that you just will never forget when they're young. And so to do this right now when it matters most is really awesome. Looking forward to seeing it continue to happen. Just because I also know people in healthcare right now that are taking advantage of that opportunity to kind of like relax, stay focused on what they're doing, and the next best thing they got to do when they show up to work, and sort of put that hat on and compartmentalize while the kids are at home learning how to do online schooling. This exact resource, when you say, hey, I care about you, I want to make sure you get to work and you can put that hat on and take it off when you leave, is exactly what they need right now. And so thank you so very much.
You're welcome.
Thank you, Ms. Snyder. I appreciate that perspective. Ms. Fecto, followed by Dr. Pugh and Dr. Pritchett.
I also think it's, you know, incredibly valuable, and I'm deeply appreciative. I'm just wondering how many childcare centers are open, where they're open, and how people who need it can connect to it if they're not aware.
Sure. So we've been working really hard with staying connected with the intermediate school districts who have taken an enormous lead in trying to identify the opened and closed centers. I don't have an exact number for you at the moment. We have a project happening this week where we're working to get a better number on those locations, so we can certainly follow up on that. We do know that the need is a little less than what was originally anticipated and expected. But for individuals who are looking for childcare as an essential worker, there is a Help Me Grow website, and I'm also happy to share that information with you, where they can provide some information about the type of care they're looking for, where that care is needed, the ages of their children, and then follow up from that website is happening at the local level to connect them to childcare providers who are open.
Great, thank you.
Mm-hmm.
Thank you very much. Dr. Pugh, followed by Dr. Pritchett.
Just a couple of questions. And first, I ditto what others have said. You know, once again, this is an area where we've been able to move in and help families pretty quickly. I was on a call yesterday, and there was someone made a comment that there are families that are being asked to hold their spots for the child care centers that their children currently work in. These are people who are not working, are not essential workers. They're at home, so they're caring for their children, but they're being asked to hold the spots. I mean, I guess that is just that, to hold the spot, but also I'm assuming that there are a lot of child care centers that are hoping to be able to maintain income. So that's one question. And then my other question would be similar to the previous question, is, you know, all the things that we're doing to make sure that these essential workers are protected, making sure that the space is being maintained, and limiting the exposures that could be present, because you have essential workers that are bringing their children to the child care center. We're not seeing numbers of children having COVID, but making sure that we're protecting that space, and that we're ensuring that there's no carriers of the virus, but then also that essential workers are being protected as well, and the space and the environment.
Thank you for those questions. Your first question related to providers asking families to maybe pay while they're not attending to hold spots. That's a question that we continue to work on daily to try and find the best support for both the parents who are being asked to do this, as well as the providers. Providers are their own small business, so they're trying to make decisions to help support that business and maintain that business. And sometimes that decision is to ask for funds to hold those spots. We're hoping that as we can get the information out about the CARES funding and the grants that will be allowable for providers to either support those who are caring for the essential workers or support those who are gearing up to reopen, that those things will fall away and those won't be such an issue for families and providers. In regards to your second question around ensuring that there are healthy and safe environments for both the providers, the children, and the families, I would echo what Diane mentioned earlier. We've been really working with providers at the local level to connect them with their health department so that they're always aware of best practices and strategies, that they're getting those supports from the individuals who have the best information about keeping the environment safe. We've also been working with the ISDs to help connect those providers to the emergency managers in those local communities to help try and get them supplies and materials to support ensuring that those environments are healthy and that they're able to screen children and their staff as they're coming into those environments. So really trying to coordinate that from the local level.
Thank you.
You're welcome.
Thank you very much. Dr. Pritchett?
Thank you, and thank you for the work that you're doing in supporting this very important part of especially our healthcares and our first responders having to go to work every day and knowing that their children are in a safe place and being cared for. Just a point of clarification, and I think you answered this with Dr. Pugh, but I just want to clear it up in my mind. So under the new CARES Act, if there is a child care center that has had to close due to lack of enrollment, and let's say the middle of next month, that enrollment, the need becomes more at that point, maybe as the stay-at-home is lifted at least partially and more people are going back to work, then the CARES Act has provisions in there to assist those child care providers with reopening, meeting the requirements to make sure that everybody remains healthy and possibly with some wages, or did I misunderstand that? So I just need a little clarification on that, please.
Absolutely. No, you understood. The CARES Act gives states some flexible latitude to utilize the funds to meet the care needs currently for essential workers, as well as ensuring that there is a supply of childcare options when the pandemic ends. So we're looking at structuring this as a grant opportunity and providing funds to support what providers need in terms of staffing costs, materials and equipment, getting their space ready again, whatever that might look like. So there will be a broad range of supports available to providers to meet both of those needs.
Yeah, and if I can just jump in to reiterate Lisa's point, and those are the literally daily conversations that we're having with Michelle Richards from the governor's office. They're very engaged in that approach, as well as folks from the state budget office. And so this isn't MDE, again, working in isolation. It's working across several entities to put those CARES dollars to use when we get them to what we feel and our partners feel is the best use.
Thank you.
Thank you very much for the questions and comments, board. Other questions or comments from board members? Going once, going twice, thrice, and gone. I'd like to thank Dr. Kenigschneck, Lisa Brewer-Walraven for a great presentation. More importantly, for their leadership in fleshing out an additional child care network in the middle of the year, in the middle of a pandemic. It really is extraordinary. And when you think about the first two presentations, board, I'd like you to reflect upon, these are entities that are already responsible for working in their networks, a food preparation and distribution network, a child care network that in the middle of the year pivoted and created additional networking capacity in very, very different ways in their professions. It's extraordinary to be able to do so, and it's extraordinary to be able to pivot so quickly, and they've done so with tremendous leadership and tremendous grace. We appreciate their work. Board, our next topic is social and emotional supports. This presentation, and one could argue backed by popular demand, Deputy Superintendent of Operations, and Dr. Diane Golzinski, Director of Health and Nutrition Services. Welcome back.
Thank you, Dr. Rice. At a time when we have to maintain social distancing to stay safe and healthy, supporting the social and emotional needs of children becomes even more important and challenging at the same time. Even from a distance, crucial and valuable connections already established between educators and students can and should continue. The department's worked very hard over the last few weeks to support educators and school districts to provide resources and guidance in this area, and I'm happy to turn it over to Dr. Golzinski to talk through some more specifics about the work we've done and the challenges we've faced and that educators continue to face that we're trying to support to ensure that we are paying attention and supporting the needs, the social emotional needs of students during this crisis.
Absolutely. Thank you, Kyle. Thank you, Dr. Rice, and good morning, everyone, again. In addition to coordinating the feeding of children during the pandemic, the Office of Health and Nutrition Services is also responsible for health and safety guidance for our local intermediate school districts, or ISDs, as well as local school districts. Under the most recent executive order, all public school districts, including public school academies, are required to outline how they will provide mental health supports to pupils affected by our current state of emergency. As a result, it was critical as the state education agency that we work to help the field to ensure social, emotional, and mental health supports are integrated into our educator mindsets and behaviors. We also wanted to share ways that local districts could increase the partnership between their educators and school-based clinicians, as well as the community, to meet the needs of Michigan's children during this incredibly difficult and stressful time. By the end of March, Dr. Rice had issued a memo to the field titled Social and Emotional Supports in a Crisis. This memo outlined the incredible times we are living in and pointed to some very real concerns for the needs of our children during this crisis. It also outlined a few of the resources available to educators to assist in helping them to integrate social emotional learning into what they were preparing to do, and introduced a new MDE mailbox designed specifically for gathering additional resources available. Those resources submitted through the mailbox are then shared on the MDE website. In addition to the social emotional learning memo, we partnered with the Michigan Department of Health and Human Services to develop the Educator's Guide to supporting social and emotional needs of students. This document was specifically in response to reports of child abuse case reporting dropping with educators not in daily contact with students, and concerns for children who may be at home with abusive adults. At the same time, the Children's Trust Fund released their COVID-19 Parent and Caregiver Guide. Both documents were designed to be additional resources for support for the field who were faced with trying to make connections in a virtual world where students are no longer in daily contact with the caring adults in their school building. In addition to social and emotional supports or resources, our team wanted to highlight the availability of the state 31N funding to support students and their mental health needs during this time. 31N is the section of the State School Aid Act, which provides a little over $30 million to expand the availability of mental health support services for students without mental health provision as a part of their individualized education plans, or IEPs. These dollars flow to ISDs, where ISDs either hire the professionals or subgrant the funds to the local districts for hiring of the mental health professionals. Social and emotional learning is a foundation for the 31N work, and 31N can in turn support the needs of our students in schools, and especially during a crisis. In addition to 31N, there are additional financial supports available through the Caring for Students program, or C4S, which is matching state and local funds for additional Medicaid dollars. So on the 31N side of our supports, our consultants are in direct contact with ISDs, answering their questions and providing technical assistance for the hiring and the use of their staff during this time. Just prior to the pandemic, we had completed a survey of ISDs and learned that 2/3 had been able to hire mental health professionals with their 31N funds. With the suspension of in-person learning for the remainder of the school year, we wanted to help ISDs and local districts determine how to keep these professionals working and reaching those children in an appropriate manner, such as through teletherapy, remote consent forms, and parent or guardian communications. For those that had not been successful in hiring their mental health professionals, we have been putting those ISDs in direct contact with universities with relevant programs who may have recent graduates looking for those exact types of positions. And finally, we put together a list of questions and considerations as a guide for local districts in writing their continuity of learning plans and for ISDs to consider when reviewing those plans, such as, are supports in place to assess and respond to the mental health needs and well-being of both the students and the staff? Or are there social and emotional learning strategies being integrated into educator mindsets and behaviors while presenting those distance learning lessons? So with that, I would be happy to answer any questions you may have.
Thank you, Mr. Garant. Dr. Golsinski, President Albridge, a comment.
Yes, thank you, and thank you for the presentation. This is so very important right now. I think a lot of people, and particularly a lot of children, are probably struggling right now with the situation and not understanding why it is that they're in the situation. I did have one quick question. I noticed on your slide for 31N, it talked about the 20% match, and if I understood you correctly, I think that was to get reimbursed by Medicaid, but I didn't quite understand that. So if you could explain that a little further, and has that 20% match, are you finding that that is a hindrance for anybody to be able to access these funds?
That's a great question. The 20% match is required by legislative language, and it must be local match. So it actually doesn't really relate to the Medicaid piece of it. The local match is something that we've been incredibly flexible, and especially now that in-person lessons are suspended, we have been able to help all of the ISDs really look at where they can find match and be able to meet that match requirement without any additional problems. The additional Medicaid funding is available to any district who has any local funds going into supporting mental health needs for students. They can then match that for additional Medicaid dollars to be drawn down to grow their efforts.
Thank you. Ms. Fecto?
I think Judy was, no, Judy wasn't ahead of me. Okay. My understanding of the 31N is that equal numbers, or the how it's distributed is somewhat equal regardless of how many students or districts are within an ISD. So I'm concerned about where there's hot spots, like in Detroit, where there seems to be more death and more cases of corona, and how that can be, is there efforts to try to reconcile that? Because they're going to be, I just don't see how they're going to be able to meet the needs when, you know, they're getting a, you know, smaller proportion amount of money with much greater need. So is there some effort to try to deal with that discrepancy?
That's a great question. Yes, the legislative language required that equal amounts be distributed to each of the 56 ISDs for this program. I think it's important to remember that that legislative language was written when none of us ever dreamt that there might be a pandemic happening in our lifetime, right? So I think that it's certainly up to the legislature to decide if they wanted to change that language. More importantly, I don't think we need to wait for that. Those professionals, whether they're hired through 31N or whether they were already hired through the local districts or the local ISD, can already be doing this work and matching their time under the C4S program and drawing down the Medicaid dollars to help expand their work. And certainly our districts where there are higher numbers of Medicaid kids, they will draw down additional Medicaid dollars. And that program is available to everyone, whether they have 31N dollars or not. So I'm hopeful that we can continue to promote C4S as a quick or faster way, rather than waiting for legislative language change for 31N.
Thank you.
Ms. Stecto, a follow-up or not?
No, that's it.
Okay, very good. Other board members, questions or comments on social and emotional supports? I will say that social and emotional supports are important, not simply for our young people, hugely important for our young people, but also for our adults as well, our parents and grandparents who are additionally stressed during this period of time, our teachers, our other educators, our support staff members, our administrators who are additionally stressed as they work to migrate to create a new learning system under these current pandemic conditions. So social and emotional supports are important, not simply for our little ones, but for our older ones as well. I will tell you that in working on our learning at a distance document over the last couple of weeks with our Teachers of the Year, we talked a lot about the importance of social and emotional supports, about reaching out and metaphorically wrapping our arms around our kids and by extension one another as we work to support our children. That was a big theme in learning at a distance, which Chief Deputy Superintendent Sheila Alice and Dr. Kiesler will be talking about shortly. Board members, one more bite of the apple. Any more questions or comments? Going once, twice. Mr. Garan, Dr. Golzinski, thank you so much. Have a great day.
Thank you.
Thank you.
Board members, our fourth presentation is on learning at a distance. This presentation will be led by Ms. Sheila Alice, Chief Deputy Superintendent, and Dr. Vanessa Kiesler, our Deputy Superintendent of Educator, Student, and School Supports. There will be a PowerPoint presentation. Ladies, good morning.
Good morning, Dr. Rice. Thank you for your introduction, and good morning, everyone from a distance. Dr. Kiesler and I are appreciative of the opportunity to present on the topic learning at a distance while we provide our presentation at a distance. Many of our educators are learning how to teach at a distance, and we're learning how to conduct meetings and make presentations at a distance. This is an entirely new environment for many of us and should help us appreciate the challenges that learning at a distance presents to our students, their families, and educators. Our presentation this morning is going to cover 4 topics: creating a common understanding of what it means when we say learning at a distance, sharing data on technology access and connectivity. I'll wait till we get the PowerPoint.
Sorry, Sheila, I was deeper in the PowerPoint than you needed to be. There we go.
There we go. There's our 4 topics. Sharing data, as I mentioned, creating a common understanding of what it means when we say learning at a distance, sharing data on technology access and connectivity, describing MDE's web resources to support learning at a distance, and providing an overview of the MDE Learning at a Distance guidance document that you heard Dr. Rice mention. So we'll move to our first topic, which is to share with you our thinking about the meaning of the phrase learning at a distance so that we have a common understanding of it. When we use this term, learning at a distance, it describes students being engaged in learning that happens outside of the traditional school building. Learning at a distance is providing students with continued learning opportunities while they are at home during an extended period of school closure, like we are currently experiencing due to COVID-19. Learning at a distance will not look anything like learning in a classroom, and the time spent in structured at-home learning activities will be different when compared to teaching and learning during a traditional or regular school day. Learning at a distance does not equate to online or virtual learning because of the digital divide that exists in our state. When both teachers and students have access to mobile devices and connectivity, technology can be used for teaching and learning. We recognize that some districts are well down the road in this process. Many others have little experience in this area due to limited devices and connectivity in their schools and communities. We understand that these districts are at the beginning steps of their journey to transition to online learning. And for other districts that do not have access to technology, alternative modes of learning are being provided by teachers to students, such as providing grade level or course specific instructional packets. As a result of this digital divide, every district will have a different approach to learning at a distance. It's important to remember that the student is at the center of all learning, including learning at a distance. When we know that students are more successful learners when they have meaningful relationships with their teachers. So while teachers are not able to maintain the daily face-to-face contact with their students, it's critically important that these teacher-student relationships continue during this time of physical distance, because our students depend on it. Learning at a distance for many is a whole new way to do school. For some, it will include the use of technology, as I previously mentioned, and for others, it will not. And so now Dr. Kiesler is going to address our second topic by sharing the results of a recent statewide survey that highlights the digital divide that exists in our state. Dr. Kiesler.
Thank you, Sheila. Good morning, board members, and thank you for being with us today. It's nice to see all of you virtually. Like Sheila said, I wanted to talk a little bit now about what we know about technology access and connectivity in the state. We partnered with the Michigan Education Technology Leaders, or METL, to do a couple surveys. The first one was a quick survey of ISDs where we simply asked the ISDs to give us their best estimate of connectivity and devices in their ISDs. And what we found from that survey is that some ISDs had as few as 25% of their students with access to connectivity and or devices, while other ISDs had up to 90% of their students connected and with devices. Overall, when you look at it statewide, approximately 1/3 of our students do not currently have access to connectivity or devices or devices. So if you translate that into student numbers, at the barest minimum, that means about 500,000 Michigan students don't have the capability to engage in learning at a distance without or with technology. They don't have technology available to do learning at a distance. We are working with the governor in a task force to identify the current gap in access and connectivity, but more importantly, to come up with solutions to address that digital divide. We are doing a second survey has been conducted with METL. This was at the district level. That concluded on April 3rd, but METL spent time last week following up with districts who hadn't responded. We want to get the most accurate count we can, and they're in the process of summarizing those results now. So that'll give us a finer grained estimate of devices and connectivity, as well as devices available for staff and devices available in schools that could be distributed to students. As I mentioned, and as Dr. Rice has spoke about here and in other places, this is an opportunity for us to think about solving the digital divide in the long term. And to do that, we need both short-term and long-term investments. The short-term investments focus on things like hotspots or other ways to fill the connectivity gap. But in the long term, we know we need to move toward ensuring that all homes have the connectivity and investing in devices so that we're set up and we don't have this kind of gap where some students have and some students don't. Thinking about this more as an ongoing long-term solution where we invest from an equity perspective in all of our students. Thank you. Sheila?
Okay, thank you, Vanessa. Moving on to our third topic, which is our newly redesigned webpage for COVID-19 resources. On the MDE homepage, when you click on COVID-19 Education Information and Resources button in the center of the page, it takes you to our newly redesigned webpage, which has evolved into a one-stop shop for all resources related to the coronavirus. The redesign of this site was a collective and team effort by many staff members in the department. Kudos to them for their collaborative work to make this site more customer and user friendly. Special thank you to Mark Howe, who is leading this redesign with still more improvements yet to come. This site includes links to many resources. If you look at the slide that's on the screen, you'll see that we have Learning at a Distance. This link houses the Learning at a Distance guidance document that we're going to talk about shortly. Guidance memos from the department, online instructional resources, professional learning, special education, career and technical education, as well as press releases and communications. And the two topics that Dr. Golzinski covered earlier this morning, school nutrition resources and social emotional learning. As I mentioned earlier, learning at a distance may or may not include the use of technology. So for districts transitioning to the use of technology in their continuity of learning plans, MDE has created a planning resource that's available on our webpage. Access to this planning resource can be found by clicking on the Online Instructional Resource button and then clicking on the District Considerations button. As districts are developing their continuity of learning plans, consideration should be given to what makes sense within their communities and include input from teaching and support staff. And so to describe more of the resources that are available on this site, I'm going to turn the presentation to Dr. Kiesler.
Thank you. So as Sheila mentioned, we knew it was important to help districts with instructional resources that they might be able to use to support learning at a distance. And so there's another section of the website, you see it highlighted here. And when you click on it, you open up into a large number of resources that can be accessed by districts, by schools, by teachers, and thanks to everyone in the department who helped populate this. There are many different types of resources here, and it was really a collaborative effort across the department. We also knew it was important to have professional learning. In this button, we partnered with partners like METL, who I mentioned earlier, as well as Michigan Virtual, EduPaths, McCall, other providers of professional learning, and asked them to identify the professional learning that was most specifically targeted, kind of their best in breed around how to do instruction learning at a distance. We know that many teachers need specific training in doing this work. And so we curated a set of resources and loaded them up here for people to access that are more about the how. All of our partners, those I mentioned and many others, have lots of professional learning available in general, and we always support our educators using that. But we did want kind of a quick one-stop shop for how to use Teams or how to use Google Classroom or whatever you needed to get familiar with the tools and some of the techniques. We also on that website have a quick list of free sketches that are available online. So if teachers want to do training online at no cost to themselves, they can find that easily and quickly. Sheila?
Thank you. And now for our fourth and final topic, the Learning at a Distance guidance document. This guidance document was written by teachers for all educators to use as they implement learning at a distance. It's designed to be a work in progress to help address the immediate needs of staff who must address the immediate needs of children at a distance during a pandemic. It's our hope that it will serve as a contribution to the education of our young people at this very difficult and complicated moment in our history. State board members, Dr. Rice sent you an electronic copy of this guidance document last week, and for our viewing audience, you can access this document on the MDE webpage that I pointed out earlier. The development of this guidance document was a collective and collaborative project, as you can see. There we go. As you can see from the many, many names that are listed on the 3 pages of acknowledgments, it was primarily written by Michigan's Teacher Leadership Advisory Council, which includes our Michigan Teacher of the Year, Kara Lougheed, and the 9 Regional Education Teachers of the Year. One of them is with us today, Amanda Clemens from Region 2. Department leadership provided substantial guidance to the development and during the development of this document. The document has the endorsement of every major education association in the state, with representation from each as either a thought partner or a task force member. The document's 2-page introduction. We'll turn to the 2-page introduction, thank you, was written by Dr. Rice. It contains many important messages, and this morning I thought I would just share a few of them with you. This is a few of them, that the document is a work in progress and was created by educators for educators. Another one is that educators need to do the best they can during this pandemic, and that their best will vary across districts because of the digital divide that exists in our state. Another message is that we need to make every effort to stay connected during this time of social distancing, so we are able to maintain the relationships that we created prior to the extended school closure. And evident throughout all of Dr. Rice's intro is an emphasis on all of us working collaboratively and partnering to support and educate our children to the very best that we can. I'd like to point out the artwork that's on this page. You'll see it's on the first page of the introduction. It was created by Doug Duncan. Doug is one of Michigan's Regional Teachers of the Year. He helped to write this document. He contributed the piece of artwork, and Doug is an art teacher in the Kalamazoo Public Schools. The Learning at a Distance document is comprised of 5 major sections or topics. You see the first page of each of the 5 sections listed on this slide. They are making your plan, essential practices, student instruction, professional development, and providing support. Each of these 5 sections begins with a guiding principle. So on page 7 of the document, we have compiled the guiding principles. There they are. The guiding principles for each section provides a framework or a guide that will assist educators in making decisions relative to that specific topic. So now Dr. Kiesler will give us a brief overview of each of the 5 sections.
So as Sheila mentioned, the first section is planning. I know you have the document in front of you, and we are obviously happy to answer any questions about the document in its entirety, if that would be helpful to you. But we wanted to highlight with the planning a couple things that we made sure, and the teachers who helped write this made sure to highlight options for both technological and non-technological delivery. As we spoke about a little earlier, we know that not all Michigan students have access to technology or are ready to use it in this way. So we wanted to make sure this document captured those pieces. And then the other thing we wanted to highlight from the planning section is the importance of districts making sure that their plans address the needs of all their students, and specifically thinking about the needs of students with disabilities, English learners, early childhood, and career technical education. And so on this page, you see just short paragraphs, but each of those paragraphs includes a link to a substantial body of resources pulled together by staff and stakeholders in each of those areas. And so thanks to the department teams and the stakeholders who helped build out the large amounts of guidance document that sit behind all of these things. Moving to essential practices. A couple things to highlight here. The teachers really felt with this section that it was important to help districts think about the questions that they should ask before they begin, and also about some of the options that are available to connect with students, different platforms. And they wanted to highlight that we need to be flexible, we need to be creative and flexible, and we also need to collaborate so that each teacher doesn't work independently, but rather we think carefully about how to collaborate and think about the needs of students and families. And I'm going to take just a minute, sorry to make you seasick, and roll back to here. You know, we talked about this on the website briefly, but just to reiterate on this online instructional resources, when you click on what's in the circle and you go to the different pieces, you can see here meeting the needs of English learners, and you can also see English language development. So there's both content resources specifically for English learners, as well as planning resources. You see we have art resources, computer science, CTE. Again, shout out to Brian Piles and his team who put together an expansive toolkit or resources there. If you haven't explored our website, we encourage you to do so. There's a lot here that we're not showing in these screenshots. Early childhood, again, shout out to the Richard Lauer and others on his team who helped pull together a great amount of resources here. We have our content resources, so literacy and ELA and math, MyText, those are the technology resources, science and social studies. So there's just a wealth of information here that is available to our educators to help them provide these learning options at this time. Again, don't look at the screen for a minute while I scroll, sorry. And now we're back to student instruction. This section, the teachers really did an amazing job in this section, thinking about practical considerations around things like what to teach, how to structure a day, how might elementary look different than secondary. It reinforces over and over the importance of being flexible. You know, as Sheila highlighted and Dr. Rice, this just isn't the same as school like normal. It has to be different, has to take into account the way that it's happening in homes across the state. Helps with assistance in choosing resources. So the flip side of the wealth of resources is that there's a wealth of resources, so it can be kind of overwhelming. So some ideas about how to prioritize, and then thinking about how to assess student learning, how teachers can do that, and how they might want to award credit. And again, I just flipped you back and showed you the MD website, but that is where we have resources available to support those teachers and districts in that learning at a distance. And we're updating it all the time. So we hope people keep looking there. This is the professional development section. Again, I was really struck when the teachers wrote this section, how much they focused on the importance of taking time for educators to get the training that they need to feel comfortable and empowered to deliver instruction in this setting. So taking the time to plan. They also really lifted up the importance of districts planning collaboratively with their teachers, with their staff, to put together professional development plans and to use this as a time of learning for educators too. So obviously we want our students learning, but it's an opportunity for educators to grow their own skills, new skills for many that they have not had the opportunity to use yet. They also lifted the idea of being creative with professional learning, and we have some guidance forthcoming about some options for that, but that professional learning and what we count as or what we think of as professional learning might look a little different in this time. And finally, providing support. Again, we just had a great presentation by Diane on the social emotional supports, but wanted in this document to lift up the idea that these really are unprecedented times and we need to take care of our students, we need to take care of each other. This section links to many different resources. You can see the hyperlinks in the document. Again, it's 2 pages of text, but it's a wealth of resources that sit behind it. Specifically wanted to highlight, there's the resource, the Educator's Guide to Supporting the Social and Emotional Needs of Students. That's a resource document that we co-created, MDE co-created with the Department of Health and Human Services. So this section really highlights the need to support each other and also the importance of staying connected. So teachers being connected to students and teachers being connected to teachers as well. And that is the end of our presentation. Sheila, I'll turn it back to you.
Okay, thank you, Vanessa. As Vanessa said, this concludes our presentation at a distance on the topic of learning at a distance. So Dr. Kiesler and I appreciate the opportunity to share this information with you, as well as insights on this topic. And so Dr. Rice, we will turn the meeting back to you.
Thank you so much. Great job to both of you. Dr. Pugh, a comment/question.
I'm coming. This was, I agree with Dr. Rice. Not only a great presentation by the two of you, thorough presentation, but thorough work. It's a lot that went into that beyond what words can say. And at a time like this, my question is with the 500 who don't have access, if there's any information on like a geographically how that is spread out. I don't know if we were able to collect that. And then if there's any information on the supports within the home. You know, having the technology is one thing, but also having parents that also can provide the supports needed for the children, if there was any way that we were able to gather that type of information. And if so, are we doing that?
Vanessa, do you want to take that question and you can talk about the second medal survey?
Yep. So yes, with both of the surveys, the first medal survey was by ISD, so we can look and see the differences in ISDs and then obviously map that geographically. And then the second survey was one that we asked districts to do, medal asked districts to do with their parents. So parents, or they did things like robocalls home or that sort of thing. So we'll get more finer grained data on not just the rough estimates, but really district by district, what kind of devices, connectivity, and then also, like I said, that survey goes into staff. Do staff have devices? Do staff have connectivity? We didn't specifically ask a question about, on that survey, it doesn't ask questions like how many parents are available, or, you know, guardians are available in the home to help with learning. It doesn't go there. So we don't have good data on that. We know that local districts are working really closely to figure that out, and it does vary local by local, but the technology survey didn't specifically ask that question.
And just a follow-up question. Also, you know, taking into account that we're off work or working from home because there's a pandemic. There are people who are losing loved ones. There are some who know multiple people. Maybe this hasn't impacted anyone. So that goes for the educators as well as the students and families themselves. And it does sound like you're taking that into account. But I don't know if there's any way to address that and look at that more closely. And then the issue of once we go back, I hear some planning already as to what the next school year will look like. But what are we thinking around when we regroup, and how do we help to pave the way for that and what that might look like?
Sheila, Vanessa?
Paving the way, I'll talk about paving the way when school resumes. It's going to be taking care of children's social emotional needs first, making sure that kids feel the connection that our teachers and our schools provide to them. So the first priority is going to make sure that our students, that our children, our kiddos are feeling well taken care of. and helping them transition back to school. We also know that there is going to be, for many of our students, there will be an academic loss. So first priority will be taking care of them socially and emotionally, and the second priority will be to identify what those learning gaps are and start to fill them. Starting the school year when we resume is not going to look like starting the school year has in previous years. It will have a different feel to it and a different focus to it. The focus will be on welcoming our children back into our schools, making sure that they know that they are cared for, missed, and glad to have them back in our schools.
And that's best case. That's assuming no interruptions next year whatsoever, and that we're able to pivot cleanly into next year. That what Sheila has described is arguably minimal disruption. It could be a very staccato year next year, as we're all aware, and that could add additional complications that could ripple into other school years beyond that. And we have had those conversations within the department and have begun to have those outside of the department as well. Dr. Pugh, a follow-up?
I'll let my fellow board member get in. I see he's getting in, and I'll see if I still have the same question.
Fair enough. Mr. McMillan, then Ms. Fecto.
Okay, thank you. I'm understanding that based on the governor's executive order, that ISDs are approving continuity of learning plans. Is that right?
Yes, that's correct.
Okay, is that all going well? I guess, I mean, as far as we know.
To our knowledge, yes, it is going well. The department has started to receive some of the approved plans. Kyle Garant is the staff member in our department who is receiving those approved. Once the ISDs review them and approve them, then they go to Kyle Garant for his identification, and then using the approval of the plans then to release state aid funds.
Okay, so MDE is not in an approval process also, it's at the ISD?
Yes, that is correct. It is at an ISD level that the continuity of learning plans are approved. Okay. They're submitted to the ISDs and then approved through the ISDs.
Okay, and then areas where there's no connectivity or very limited, is learning going on? I mean, are they using books? I mean, textbooks, they're coming and picking them up, and are teachers doing conference calls, or, you know, are they figuring out other ways?
The answer to that question is yes to everything that you said. So yes, I'm going to go back and say what I said, because I just went live now. So yes to everything that you said, Mr. McMillan, that through our food service delivery, learning packets are being distributed as well as picked up through our meal distribution, food distribution sites within our school districts. Students and families are picking up and returning learning packets, textbooks, books. Teachers are reaching out to students through phone calls, attempting to stay connected to them, making sure that if they have questions about their learning, that their questions are getting answered. So they're continuing to support their students. It just looks very different than using the technology that exists in other school districts. But absolutely, where they are doing the very best that they can to support learning with their students.
And if I could add to that we have 842 LEAs in the state, 545 traditional school districts, 297 public school academies, and this takes on a different cast in each and every one of them. We've had the opportunity to speak with the vast majority of our superintendents in the state in regional meetings, and have learned a great deal about how this is being cobbled together, district by district, locale by locale. It does not look the same in any two districts in the state. I'm not arguing that that's good. I'm not arguing that that's bad. I'm not passing a judgment on it. I'm simply describing. It's not a normative, it's descriptive. And so I share that with you because, you know, clearly we don't prepare, or we didn't prepare anyway, for this pandemic. There was no extraordinary preparation made in advance thereof. And so in the short run, what we've said to local school districts is, your job is to do the very best that you can. If that means migrating to a virtual learning environment, if you have that luxury, those resources at home, and in both in the homes of our young people and the homes of our staff members, beautiful. But if what you have in your local school districts are paper, pencil, books, if that's what it is to cobble it together, that's the best you can do in the short run. And you can't be held accountable for the absence of resources that were never there to begin with. That said, however, midterm, long term, we have a responsibility to build a better structure in the midst of this pandemic. So the expectation in April is a different expectation than the expectation will be in September or October. And we are working very, very hard with external partners, with the governor's office, with many others, to raise our game across the state. The notion of a rising tide, raising all boats, is really relevant here in this particular situation. So Dr. Kiesler mentioned the 500,000 children whose homes don't have a computer or connectivity or both. Perhaps a few 100,000 more homes have those devices, have the connectivity, but the children need supports to use that technology, perhaps young children, perhaps special needs children, perhaps some English language learners. We have a responsibility in the next 6 months to build a system that is more capable of handling this pandemic in a second wave. Now, I'm not suggesting by any means that in 6 months we'll have a fully formed virtual learning environment in our homes. Not vaguely possible that that will take place. But what passes as acceptable now and what passes as acceptable in 6 months are going to be very different. The expectation will rise. Mr. McMillan, you look like you have another question on your face.
Just real quick, one follow-up. Now, a lot of parents are home. They weren't planning on it. So are there ways that we can help districts, or I'm hoping that districts are, trying to take advantage, so to speak, of that, in that, parents, there can be a lot of one-on-one help now that, potentially wasn't able to be done as much. So I hope that we're not, I hope that we are encouraging and not discourage. I know nobody would discourage it, but, finding ways that maybe this period of time could have, more focused, individualized attention on the children and their needs.
Yes, and so we are engaging parents through our Learning at a Guidance document, through our social emotional supports document. We have a document in progress, which has not gone out yet, but which will go out soon, on family engagement, working with schools to better engage our families. Ms. Alice, Dr. Kiesler, any additional thoughts?
No, I think you've covered it very well, Dr. Rice. Thank you.
Mr. McMillan, other questions or comments?
Nope, good for now.
Okay, thank you very much.
Thank you.
We have Ms. Fetto, Dr. Pritchett, and Dr. Ulbrich.
Okay. I have some questions on special education, but I'll wait till the next presentation on that. I live in a house with 2 teachers right now, and I can tell you there is a lot of anxiety about what their expectations are, trying to meet these needs of the students my husband's a special ed teacher. He has like 16 students on his caseload, trying to figure out what he should be doing. And my daughter is a long-term sub teaching health who has 200 students. I don't know how she would be able to call 200 students or connect with them. And she's trying to figure that out. But it seems like the districts are being very supportive. They seem to be working together. But I can tell you, even with that, there's just a lot of anxiety about what this is going to look like, what this means. And I say that because I think your guidance and getting it up so quickly, people must have worked tremendously hard to do that. And I think that's incredibly helpful. So I'm very appreciative for personal reasons as well as, broader reasons as a board member. I did notice there was no guidance on how to teach health on that. And which includes sex education. She's like trying to figure out what she's supposed to do. I'm a little nervous as a brand new teacher. So if you could do something on health, that would be great. So my concerns are in a couple of things. Once I had the opportunity to talk to Ionetta Wright from DPSCD, and they're working very hard to get tablets to all the students with some sort of device to provide connectivity. I'm wondering about the long-term funding for this. I think they're working on donations, but I think being able to maintain because they will inevitably get broken, or there'll be glitches. So I think looking at how we do our funding for technology based on the communities raising those mills, and if you're in a poor community, being able to raise the sufficient funds is going to be very difficult. So I'm just wondering if we're talking long term, the gap. If there's also discussions about how to revise our financing, how we fund these types of things, because I think that's an important discussion long term. To do that. So is there conversations about how to maintain this, this long-term plan, which includes restructuring our funding methods?
So two thoughts on this issue, and then Sheila, if you have additional thoughts, please share those. One, we've been in conversation with our foundations in the state. They have an interest in this issue, and those conversations are at the beginning stages, but we have engaged them, and there is a tremendous interest in this digital equity question among our Michigan foundations. So that's the first piece. The second piece is that there is CARES Act funding, which is permissible to be spent on addressing the digital divide, distance learning, and the like. And there will be more conversation on that in a presentation this afternoon by Kyle Garand and Joetta Parker. So more in the short term, in the next couple of hours, and then over the next few weeks and few months, additional information associated therewith.
And the only thing I would add, Dr. Rice, is that there is some flexibility that's allowed with the title funds for districts that have not spent their title money. They can use their title funds for their Title I Part A funds for mobile devices and for connectivity. They can also use their Title II funds for teacher training. So some of the existing funds that districts have right now that they haven't spent can be used to support technology as well as professional learning for educators to use that technology. And we have communicated that to our districts.
Okay, and I did have one last question, was on as a foster parent and someone who's connected to families that are really at the margins. I see now a number of the families that I have been connected with through the foster care system are homeless, are moving around quite a bit, sometimes from district to district. And I'm wondering how is there any work with DHHS in identifying where these people are and how to make sure that they don't fall through the cracks?
So Sheila, do you want to answer that?
Dr. Rice, I'm going to let you answer that one.
So that is expected to be a part of continuity of learning plans that each of the 842 districts is expected to put together. Those plans are associated not just with broad strokes outreach, but how do you reach all children? And all truly means all. It means special needs children, it means homeless children, it means migrant children, it means children who on a good day often we are challenged to serve. And in a pandemic, it is not a good day. It's not a good day, a week, a month, a period of time. But we are responsible within those continuity of learning plans to demonstrate how we are serving all children. So there is outreach that's being made to children in particular communities. For example, to a homeless shelter. But as you point out, there's a lot of pinballing around in communities, and it's very, very difficult. It's a lot easier to serve children who are rooted than it is those who are uprooted or unrooted. And so this is a challenge. It's particularly a challenge in some of our higher poverty school districts.
Are you able to coordinate with other state agencies in identifying these where they are?
We are, yes, but the mobility is very quick. And so, you know, it's not to say that we can't connect with and don't connect with MDHHS and MDARD and other state agencies. We certainly do. The problem is that those state agencies are no more knowledgeable necessarily about where children are, families are at a local level than we are. The entities best capable of knowing this are the local school districts, not the ISDs or RESAs, not the State Department of Education, but rather those local school districts and even those local schools. It sometimes is a function of the relationship between an individual teacher, counselor, administrator, support staff member, and a family member. Literally, that's our connection, that local school connection. It's the most important. Okay, thank you. Dr. Pritchett, then Dr. Albridge.
Thank you. First of all, I want to commend again the writers and the advisors on this document. It is very well done. It is concise. I have heard lots of positives on the document overall, so thank you to everyone involved in that. I appreciate Dr. Rice's comments a few minutes ago about expectations for the continuation of learning plans. Because I think we have to keep in mind constantly that though those plans are being written with districts and teachers to boards of education, based on what they have now, based on what they know now, that they will probably monitor and adjust those even between now and when school finishes up the first part of June. And certainly if we are faced with this challenge or other challenges in August, then the expectations will need to be different at that point. So I appreciate those comments, Dr. Rice, and the fact that while plans are being written right now, we've never been through this before. Districts have never been through this before. And so they are saying, okay, this is what we think we can do now, but for them to keep in mind, but we need to look forward on what can we do differently or better or more appropriately as we move forward, so that more students can be serviced in different ways. And my last comment would only be that just from what I'm hearing in my own personal experience, personal feedback from instructors to students, be it just a quick email, if that indeed is something that the district is able to provide for students, or a quick phone call or a note in the mail, makes a tremendous amount of difference. I'm not saying grades, I'm not saying you got 5 out of 10 on this, not anything close to that, but great job. Thanks for putting forth that effort. Does all sorts of different things. First of all, it confirms to the student cognitively, oh, okay, I got that. But more importantly, it says to the student, I think about you and I care about you, which handles the emotional and social part of it. So that's kind of just my observations as we've gone through. We're now entering the 5th week of this. Sometimes it can be that, I don't want to use the word simple, but that direct to students, whether they're in kindergarten or whether they're your 12th grade AP students. So thank you.
Dr. Pritchett, actually, thank you for those comments. And there is research on the power during the summer of simple outreach, as you're referring to young people in a book reading program. Distribution of books every week and a half, according to a James Kim research project. Children send in postcards to their teachers. Teachers respond with postcards back to the children. And he has found that there's a power to that second postcard, to the affirmation of the teacher, the exhortation of the teacher. Great job, keep reading. Hope you like the next book better. Glad you enjoyed this book. What did you think about this? What did you see as the relationship between this book and this book? Just very, very simple postcard-like comments can ratchet up the engagement of children and by extension, the learning of children. Those are pretty well-known studies on beating back the summer slide. So I appreciate you pointing that out. Thank you. Dr. Ulbrich.
Yeah, so I would just echo some of the comments that Judy made. I thought they were spot on, and also the concern I believe Pam raised as well about the digital divide and how pronounced it is. It's always been there. We've always known about it, but now it's taking on a whole new meaning. I just had a quick question though. We talked a lot about what you're hearing from districts, from ISDs as they are approving the district continuity of learning plans, which is wonderful. But all of the charter schools are also providing continuity of learning plans to their authorizers. And I'm curious if you're hearing any feedback from the authorizers themselves. Is it similar to what the districts are experiencing, or is it different, or are you not hearing from them much at all?
Dr. Rice, you want to take
Sheila,
that?
do you have any, Sheila or Dr. Kiesler, do you have any reflections?
I have not had any contact with the charter authorizers on the how the continuity of learning plans are coming from a charter school perspective. So I'm unable to respond to your question, Dr.
Yep. This is Vanessa. I know that our public school academy unit has just been, like they always do, supporting authorizers and PSAs and getting the plans in. I will get a specific update if there have been any concerns. They haven't reached out to me with any concerns, which usually suggests there are not concerns, but I'll double check while we're on this call.
And we will get additional information. Remember, those continuity of learning plans are due in, approved, and begun on or before April 28th. So at our next state board meeting, we will share with you more fully, not simply what we're getting from the traditional publics, the 545, but also the 297 public school academies. We'll get an update from Rob Kincaid and just give you a better flavor for that. I don't have a better answer at this point, but again, it's April 14th and the process began a little bit more than a week ago. Dr. Pugh, a question?
My question related to the plans. I know I've heard this question resonating in our community, and I've had an opportunity to talk to the local superintendent here, but the question has been around input for parents. Some have asked could they get input as the plans are being put together. I know that it's such a short timeline and a lot is going into putting these plans together, but more so maybe even if that can't happen, which I could understand why it definitely would not, but once the plans are together, is there an opportunity for interaction? And maybe if we can look at the plans to see if that is happening. I know in talking to the local superintendent here in Saginaw, there seems to be an opportunity for parents to know exactly what every body within the school district should be doing, what the parent should be expecting from the counselor to the teachers onward, and then being able to give input. I think that they're going to have a calendar, but just wanting to make sure that there is, if at all possible, opportunity for input for parents.
Sheila, can you share in that regard?
In the executive order, it does include the involvement and notification of parents of the plans, and that districts are required, as well as ISDs, to post their plans on their website. But it does include communicating the plans to parents. It also includes involving parents, involving teachers, educators, and involving board members in the development of the plan. So it's looking at pulling together a collaborative group of individuals, all of which will have responsibilities for implementing the plan, to have a role in developing the plan.
Thank you, Sheila. Dr. Pugh, a follow-up?
No, that was great. And just, again, just hoping that parents can, it sounds like there is, can give input because they will be able to follow along via the calendars.
When I think I hear a common theme between your sharing and that of Mr. McMillan, the importance of engaging parents as partners, grandparents as partners when possible. The reality is we're going to have to cobble it together. And to the extent that we thought we could get this done without parents or grandparents, and we never could, but boy, it's become increasingly obvious that we need them as partners in this new learning at a distance world. And we do use that term advisedly, as Sheila Alice mentioned. It's not a virtual learning report, and it's not a virtual learning world at this point. It may be in certain small numbers of districts, but for the vast majority of districts across the state, they are cobbling together some version of paper, pencil, and online. And so it's that combination that is so profoundly challenging. If we had been able to migrate wholly to a virtual learning environment, or virtual learning platform, would be a different world. But that's not what we've been able to do. And those partners are all the more important in this cobbled together world that we have in our 842 LEAs. Other thoughts or comments or questions from board members?
Just one more thought along this line, and you reminded me, I think said something along the lines. I know that the governor has hoped to increase adult learning. Have we looked at using this as a problem opportunity, an opportunity for us to address parent learning along with children? Just a thought. I know there are many other initiatives that are underway, emergencies, but maybe this is an opportunity for us to think about that.
It's a great idea. I'm not aware of any efforts immediately underway. Brandy Johnson, our governor's representative on the state board, is with us. Brandy, do you perhaps have anything to add on that topic?
No, I don't have anything to add. I would agree with you that it is a great idea, and you know, I think that's something that we could certainly share with locals as they're developing a plan for consideration. You know, looking ahead, we recognized that obviously we have unprecedented unemployment rates in Michigan, and recognize that adult training programs and education programs are going to be a very high priority as we ultimately are able to restart the economy and lift the stay home, stay safe restrictions. Some of those jobs have gone away more permanently, and so we recognized how utterly important it is to engage adults into training programs quickly as we come out on the other side of the pandemic.
Thank you very much. Thank you to both of you. Board members, one last bite of the apple. Questions, comments? Nope. Hearing or seeing none. Ms. Alice, Dr. Kiesler, thank you very much for your presentation. Board, it is 11:43. And with your permission, I would like to suggest that we move up from the afternoon, our shortest presentation. It is the presentation on assessment and accountability by Dr. Kiesler. It was due to take 10 small minutes with Q&A included. Do I hear any objections to that amendment to the agenda? Would the board like to formally vote on that amendment to the agenda, or is the board comfortable with silence dictating the amendment to the agenda?
No objections.
I hear no objections and no need to vote. Very good. Hearing and seeing none, Dr. Kiesler will be our next presenter on the topic of assessment and accountability, usually a rousing topic. Today, I anticipate being much shorter and much less charged. Dr. Kiesler, if you would, please.
Thank you, Dr. Rice. Yes, I am excited to be the most popular person on the agenda today with my assessment and accountability update, which is never the case when we're talking assessment and accountability. So as you all likely know, we received a waiver from the federal government for all assessments and accountability that are required under federal Every Student Succeeds Act. So we are not administering tests like the MSTEP, the SAT, those tests, and we're not running our index system. And then we also, Executive Order 2035 on April 2nd, we temporarily suspended compliance with the state laws that are affiliated with those pieces as well. So at the present time, assessments are suspended. We are, as the executive order spells out, working with the College Board around an optional SAT and PSAT for students in the fall for those who want it, as that is an important test for kids for a variety of reasons. But that's where we are with assessment and accountability right now.
Board members, do you have any questions, comments, thoughts, fears, phobias, neuroses around that presentation? President Ulbrich, any reflections?
No, I think it's wonderful that we are foregoing any testing or assessment for this year. Obviously, it would be very, very difficult under the best of circumstances, and these are not the best of circumstances. I'm also very appreciative of the fact that we will have an optional SAT for students in the fall. I know that that's been a concern for a lot of the juniors who are looking forward to applying to colleges and universities and being able to ensure that they still have that opportunity. And in the state of Michigan, it is free for students, and that will continue. So very excited to hear that, and I think students will be very appreciative of that opportunity as well. Beyond that, thankful to the governor for the executive order that suspended a lot of the state law that was definitely in question on what was going to happen with that. And beyond that, I hope that this is a learning opportunity. So in the future, we can hopefully have more conversations about why we do accountability and what it really should be used for.
Thank you, President Aldrich. Ms. Fecto, then Ms. Johnson.
I just wanted to thank you, Dr. Rice, and you, Dr. Aldrich, for the letter, taking a leading role and getting that letter to Secretary DeVos on this issue. I'm grateful for that and all the people that supported, including our fellow board members and people at MDE. So I think it was wise, and I'm glad there was an answer so quickly on this. So thank you.
Thank you. Ms. Johnson.
I was just going to add that, thank you to the department for all the great work that you've done, particularly with College Board for assessments and whether they be for diagnostic purposes or college admissions purposes. Really appreciative of the work you've done with College Board, and the governor's office and the governor herself is also engaged with conversations with the College Board, thinking about how we best support our current juniors and seniors as they hopefully are able to make successful transitions into post-secondary, given the governor's 60 by 30 goal. I hope that as we communicate to districts and look toward the fall, that although we recognize that those tests shouldn't be used for accountability purposes, that we make every effort to strongly encourage students to take the SAT in the junior and sort of minimize the word optional that we say out loud, because we really want to send a message to all students that they really should take the SAT to help unlock possibilities for them later on, regardless if they themselves think that they're a college material or have immediate plans to pursue post-secondary, just like it is par for the course for all juniors pre-pandemic to take the SAT. I hope we really encourage that in the fall.
Thank you very much. Other board members, reflections, questions, comments? Hearing none. It is 11:49. If we could reconvene at 12:30, that would be terrific. We are on our lunch break. Thank you so much.